My name is Alicia Cisne, and this is my assessment on Andy for Maryville University Nursing 612. The first thing you're going to do in your assessment is their mental status. So, can you tell me your name?
Andy.
Date of birth?
11/23/79.
And who's the president?
Donald Trump.
What year is it?
2017.
How old are you?
37.
Good. So he's awake, alert, and oriented. Next thing you're going to do is you're going to inspect their skin, make sure that it's warm and dry, that it's intact, there's no lesions or swelling that you can note anywhere. Inspect their hair, make sure that it's all intact, that there's not any dryness or lesions, and palpate the scalp. Make sure you don't feel any bony prominences, any masses, lesions, or there's no tenderness. Go ahead and do the facial bones and your mandible, checking for T&J, the crepitus there, and then you can also do the sinuses at the same time since you're palpating. Maxillary and frontal, palpate the auricle of the ear, pinnacle, and then you can go ahead and do the cervical, their posterior auricle, pre-auricle, submandibular and frontal, and then all the cervical lymph nodes, and then submandibular, and then comes out an axillary, making sure that there's no swelling in any of the areas or any tenderness. And then you're going to go to inspecting the eyes. Sclera is, open your eyes please. Sclera is white, conjunctiva is pink and moist. I don't see any lesions or anything. You can test for the red reflex. And those are good. Pupillary response. And then you're going to do the visual field. So you're going to go up to one side and down, one side and down, and then for accommodation. And that would be testing cranial nerves cranial nerves 2 and 3. Then next you're going to go to looking at the ears. And inspect on the inside. Organic membrane is pearly gray with good cone of light. I see no cerumen, drainage, swelling, or redness in that ear. This side, there's a little bit of redness on the tympanic membrane, but there is no swelling. Cone of light is good. There's no cerumen. You can also do a hearing test. We're going to do whisper.
Baseball. Basketball.
And then you're going to do the Weber test, which tests to make sure that hearing is equal bilaterally. Can you hear that on both sides?
Yes.
Okay. And then you're going to do the Rhine test. So tell me when you don't hear that anymore.
Okay. Okay.
And that tests bone versus air conduction, and air conduction should be twice as long as bone conduction.
Okay. Okay.
All right. And then we're going to look at his nose. So we're going to test patency first. Patent on both sides. There's no tenderness. I'm going to have you look up for me. And turbinates look good in place. There's no drainage or swelling or redness. Septum is midline. No problems that I see there. Then we're going to go to the mouth. We're going to look at the oral mucosa. Can you say ah? And it's pink and moist, and there's no lesions. Stick your tongue out for me, and then up, and then to one side, and to the other. Good. And then teeth are nice and pearly white, And stick your tongue out again. I'm gonna look at the tonsils and the uvula. The uvula is midline, tonsils are pink and moist, soft and hard palate move up and down. I normally would test gag reflex, but his is really strong, and we have problems afterwards, so we're not going to do that on his test. We're going to also look at the neck a little further, make sure the trachea is midline. Going to look at the thyroid. Can I have you swallow for me? Good. And again. Okay. There's no nodules or anything there. I'm going to check carotid pulse one side and the other. Okay. There's equal, rate was regular. And then we're going to check his sensations. So tell me if that's soft or hard.
Soft. Hard. Soft. Hard. Soft. Hard. Hard. Soft.
Good. Sensations are intact everywhere. I'm going to go ahead and feel for pulses. Radial. Brachial. Posterior tibial and pedal. Pulses are intact everywhere. To continue with the circulatory, we're going to go ahead and listen to the heart. Apical. Pulmonic. Herb's point. Tricuspid and mitral. And then here any clicks, bruise, rubs, or murmurs. Gonna feel the precordium. Feeling for any abnormalities, any thrills or heaves. And then I'm also going to feel apical pulse. Then we're going to go and assess the lungs. Part of the assessment for the lungs is making sure the skin is pink. Caprica would be less than 2 to 3 seconds. And you wouldn't see any cyanosis or in the lips or in the fingers or anywhere. Making sure that chest rise and fall with equal, rate is regular. You're going to do tactile for minutes, 99.
99. 99. 99. 99.
Your arms out for me.
99.
Make sure that there's no dullness, because that could mean that there would be some consolidation. And then you listen to the lung feels. Okay, this sounds equal. I'm going to go ahead and have you turn and go to the back of the bed so I can look at the back. So again, you're going to make sure that chest rise and fall is equal. And a good way to do that is test for diaphragmatic excursion. So have you take a deep breath in for me. Bring and one more. Hand should go out equally on both sides for that. Then you're going to check tactile firmness.
99, 99, 99, 99, 99.
And then you're going to percuss. Tympanic dullness, kidney consolidation again. Hyperresonance could mean that there was like an extra air pocket. And you're gonna listen. While I'm here, I'm also going to look at the acrostovertebral angle, making sure that there's no tenderness in the for the kidneys. And then I can also look at his cervicals and lumbar spine. Can you go ahead and bend forward a little bit? Making sure that there's no tenderness or any movement of the spine to one way or to the other. That could mean kyphosis or any problems. I'm going to go ahead and come back to this side. I'll have you lay down, and we're going to look at your abdomen now. First thing you want to do is inspect to make sure that the abdomen is equal on all sides. You don't see any scars or any swelling, any masses are noted. Then you're going to auscultate in all 4 quadrants. Chest valves are normal active. Then you're going to switch to the bell of the stethoscope. You're going to listen to the aortic, the iliac, renal, and femoral pulses. You're going to palpate first lightly, making sure you don't feel any masses or there's no tenderness anywhere. And then you're going to do deep palpation, seeing if you can feel any organs, any tenderness or any masses. And then go ahead and feel for the kidneys. And then you're going to go ahead and percuss for the liver quarter. Which is right below the rib cage, and you're going to percuss for the spleen. You should not feel the spleen. It should be dull, and you should not feel the spleen below the rib cage. Go ahead and kind of sit up now. Now we're going to check some of the motor skills. So have you bend your arm out for me. Relax it all the way. This is checking your reflexes. And then we're going to check his motor skills. How about you walk in front of the bed for me, just normally, and then do 1 foot in front of the other. And do 1 foot in front of the other. And you'll have you stand here for me. And then put your arms out in front. And then close your eyes. Good. Making sure that they don't sway, that they have a normal gait. Also going to do a shoulder shrug. And that tests cranial nerve 11. I'm going to test the strength of all of his muscles. So push out. Okay, push it forward. Come back. And down to the side. The other side. And then kind of turn it. Good. And arms out. Push down. And then push your legs out. Come back in. And then if you can, push up with like one leg. Pull down. And push up with one leg. Good. Good. Strength was 5 out of 5 in all of those extremities. Also, are going to have you, now would be where we do the neuro test. A lot of that I've already done. Olfactory we did before the recording. You just occlude one nostril and have them smell something that's similar and make sure that they can name off what it is, and then do the other side. Optic, you do just cranial nerve 2 with their vision with the Snell and E chart, which his was 20/20 in both eyes, and then the pupil reaction, which was pupils were equal, round, reactive to light, and accommodation. And then 4 was the cardinal views, which his was normal. And then, so we're going to do cranial nerves 5, 7 right now. And that is to puff out your cheeks. Okay, good. Smile for me. Okay, wrinkle your forehead. And then eyes open, shut. Okay. And then frown. Okay. So that would was cranial nerves 5 and 7. And then whenever I did inspect his mouth, I was testing cranial nerves 9, 10, and 12 by sticking out his tongue and moving it from side to side, and then the swallow reflex. And we did 11 with the shoulder shrug and the neck range of motion, and so that gets 1 through 12. And checked cervical and lumbar spine already, and checked reflexes, so I think that's it. That concludes. Thank you so much.